Welcome back. You're watching McLaren Port Huron's Today's Health, and in this segment we're really excited to meet Pat Keigher. Pat is the Regional Director of Cancer Services for the Karmanos Cancer Institute, and that will include McLaren Port Huron. Pat, welcome.
Nice to be here. Thank you.
I'm so excited to, because we haven't even really broken ground on the Karmanos Cancer Institute at McLaren Port Huron yet. So I'm wondering what kinds of things you're doing before you even get going on that.
Well, there's a lot to building a cancer program. It takes many, many months. Actually, a cancer center, it takes many, many months of planning, and aside from the bricks and the mortar and the square feet that we need, a lot of those decisions really are driven by the program and what we want this program to deliver to the patients here in the community. It can be the space that's needed, what are the services that we're going to offer, the types of equipment, and all of that is what really drives the architectural and the construction plan. So a lot of pre-planning. It's definitely a team project, and making sure everybody's at the table involved in those decisions.
Well, as you know, we've had a really great cancer program for many years at McLaren Port Huron, and I'm wondering what will change and what kind of services will be added.
Well, agree, a great program's been here. The program here is accredited by the American College of Surgeons Commission on Cancer. That's a huge achievement and validates the quality of the care that's provided here. And becoming now part of the Karmanos Cancer Institute is only going to improve the care that's delivered in this community by McLaren Port Huron.
Tell me a little bit about the NCI designation that the Karmanos Cancer Institute has.
That is a very prestigious designation. There's only 41 in the United States. Karmanos is actually one of 2 in the state of Michigan, so it's not something that's easily achieved, and it drives and it speaks to the quality of the care. Those designations do not come easily. There's many requirements that have to be fulfilled when they are surveyed. So I think adding the Karmanos NCI designation to this community, to an already successful high-quality program, is only going to enhance the cancer care provided here.
What services will be offered in Port Huron?
Currently, 60% of the members of the community or patients leave this area for cancer treatment, and 40% of that is related to radiation oncology treatment. So within the new cancer center here in Port Huron, there's going to be radiation oncology added. The equipment that we'll be using will be consistent across all the Karmanos sites. There'll be one platform. So wherever the patient is treated, whether they're treated locally or they need to be treated, maybe with a subspecialist, or if they're vacationing in Petoskey, they're going to be assured that the treatment is going to be delivered with the same type of equipment, the same standards, the same nursing protocols. Huge programmatic benefits. Very exciting time.
That is very exciting, and I'm wondering too about clinical trials, because of course we all think that that's just pretty high-level stuff that most patients don't get involved in. How does that impact the care?
Great question, and that is another huge benefit of being a Karmanos Cancer Institute site. With that NCI designation brings great opportunities for clinical trials, and I really want to kind of demyth the viewers that clinical trials, they're the drugs that have been researched by facilities such as Karmanos over many, many years. So the treatments they're getting today were the research that was done by Karmanos years ago. So patients can be assured that they're going to be offered the best available treatment options, particularly coming to a Karmanos cancer site. Those trials are only available through an NCI designated facility, so by spreading that out into this Port Huron community, they're going to get that advantage as well in their care.
So there won't be any more, well, you can get a better or a more recent or a latest and greatest opportunity somewhere else, because that's what you're doing in your clinical trials.
Correct. We're bringing the care to this community versus the patient having to travel elsewhere to receive that care, whether it's, you know, assuring that they're getting the best treatment options that are out there, or the opportunity based on each patient's individual cancer type and case, is there opportunity for clinical trials. And there's just thousands that are available, and again, but they are, you know, patient specific. But having that opportunity for the cancer team to consider this patient for a trial is significant.
I can't let you go without asking you, how about the body, the patient's spirit? You're taking care of that body, you know, and how do you encourage people along?
Absolutely. That is a healing component that the patient needs to be involved with, as well as their caregivers. I think the Cancer Center, the building piece of it, is going to give that healing environment. It's going to give that sense of comfort to the patients as they heal. I think the program's going to help them focus on getting better, and the Cancer Center will focus on helping them get there. Patient navigation will be a huge piece of that, so that if the patient has needs outside the typical clinical ones, whether it's with their physician or their nurse, there's going to be the support team that they're going to need, whether it's nutrition, social, financial, transportation. All of those needs are going to, the navigator's going to help drive that. And I have to say, the navigator here at Port Huron is top-notch. So it's going to be a great service for the patient.
What would you like to say to future patients at the Karmanos Cancer Institute?
I would like them to be assured in the care that they're going to receive here. They don't have to travel. They don't have to add one more burden to their life. A cancer diagnosis in itself is huge. And I think being assured that the care here at Port Huron Karmanos is going to be the care that they need and that they deserve, and they need to be assured that the specialists are here, whether locally or within our system.
Thank you so much.
Thank you.
Stay with us. We'll be right back.